Let's do this. Welcome to breakout session 1. My name is Kate Ueland, and I'm a registered dietitian here at Seattle Cancer Care Alliance. I see patients in both the prevention and survivorship settings as well as during treatment. So I kind of cover the whole journey of cancer treatment. Today, I'm going to be talking about the power of choice. Right? So when you talk about diet and lifestyle factors, they're modifiable factors, and these are things that you have choices in making, right? You can choose to get up and exercise or not. You can choose to make this dietary choice or this dietary choice. And so I want to spend these next 45 minutes just kind of going through the different choices that impact cancer risk. And I know, so here is my objectives for the talk. There was a new report, a new study that was just released last week, very new data that I want to go through because I think it's a really relevant study. It talks about new cancer diagnoses, which is, I just want to be completely transparent that I understand this is a survivorship program, but it's still relevant. And the things that we're going to talk about that the study looks at is still relevant for you as cancer survivors. So we're going to start there. And then I picked out some hot topics that I hear people ask me about often. And so I want to look at those a little more closely. And so those are going to be vitamin D, omega-3 fatty acids, oil versus just eating fish, intermittent fasting, we'll look at the ketogenic diet, and then we'll end with sugar-feeding cancer. And if I suppose if you have questions, we'll address them at the end. So let's get started. Okay, this is the news report that came out. How many of you have seen this? 2, 3, 4, 5, 6, 7. Yeah, so awesome. Did you read it? I mean, yeah, right? Just like we're very like headline centric these days. Yeah, so just like shout out a couple thoughts from reading this report.
The ultra-processed food connection.
Yeah, that was profound to you? Great.
I knew that.
You knew that, but yeah.
Just reinforced it.
Yeah. Yeah.
The idea of a Mediterranean plant-based diet versus high fat or whatever that people are eating.
Yeah, so just the ongoing support for a Mediterranean diet plan. Yeah. One more. Yeah.
Less meat and pretty much all like processed meat especially and going towards more vegetarian.
Yeah. Yeah, so we're going to look at we're going to kind of take a little bit of a deeper dive into those things that they looked at in that study. Okay, so here's kind of some of the specifics from the study. So it was out of Tufts University, and just it's been well recognized that poor dietary habits have been associated with cancer risk. It's because all nutrition studies are very complicated, it's hard to really find significant associations. And so this was a really, I think, profound study in how creative they got to get to these results. So what they did is they took data from two recent cycles, so it kind of goes back because so from 2013 to 2014 and 2015 to 2016, they looked at the National Health Nutrition Examination Survey, so the NHANES. Is anybody familiar with that examination survey? It's like big, massive amounts of data that you can pull from those studies or those surveys. And they looked at populations of people 20 and older. So all of this information is in regards to people that are 20 and older. And what they found was out of all the new cancer diagnoses in those two cycles, about 80,000 of those could be associated with poor quality diet. And that's where they get this 5.2%. So that 5.2% is that 80,000 new cancer diagnoses. And so what they did then, this next section I just thought was really interesting. So compared to percentages of new cancer diagnoses in other modifiable related factors, this suboptimal diet is pretty on par. So if you look at excess body weight, 7 to 8% of cancer is attributed to that. Alcohol is about 4 to 6%. Physical inactivity is about 2 to 3%. And these days, we have most of the general public has a good understanding that genetic mutations have between 5 and 10% are attributed to all cancer diagnoses. So when you look at it and compare in those regards, it's a fairly significant amount of cancer diagnoses that are in that modifiable risk category. And so then what they did specifically is they took 7 dietary factors. Who's familiar with the American Institute for Cancer Research? You should all familiarize yourself with that institution because it's fabulous. And so what that institution does is it combs through all the data, the new data on diet and lifestyle factors, and it kind of it categorizes them. And so what this study did is it took any factors that had convincing or probable evidence associated with them and kind of looked at those specifically against 15 known cancer diagnoses that have modifiable risk factors included. And so the 7 that they looked at were whole grains, processed meats, total dairy products, vegetables, fruits, red meat, and then sugars. This study looked at sugar-sweetened beverages, but the AICR does not include that as a category. And the reason that this study did is because of its relationship to increased adiposity. And so we'll look at that as well. So here's the major findings, and they kind of summarize this in the CNN report. But colorectal cancer had the highest number in proportion of diet-related cases. So of those 80,000 new diagnoses, 38% were colorectal. And the biggest components of the three biggest contributors of those 7 were low consumption of whole grains and dairy products, and high intake of processed meats. And that's kind of where you're pulling that information from. And then I've just listed here the other cancer diagnoses associated with poor diet in descending order. And so among the 7 dietary factors evaluated overall, not just highlighting the colorectal cancer, low consumption of whole grains, dairy, and high intake of processed meats were the most common among all of these. I'm sorry?
Can you repeat?
Oh, yeah, so she asked me to repeat what I just said. So among the 7 dietary factors that were evaluated in this study, low consumption of whole grains, high intake processed meats, and dairy were the biggest 3, the largest contributors to the poor diet quality of all 7 that they looked at. Does that make sense? Okay. So let's take a closer look at the recommendations. I thought this would be kind of a fun exercise. So yeah. Did you have a question? Oh, you're just, okay, sorry. So the first, we're gonna start with whole grains. So what is a whole grain? It's up here, but who wants to shout out and tell me what a whole grain is? What's the definition of a whole grain? Non-processed. Another one? Plant-based. Okay, plant-based. So the whole grain, by definition, and I have this fancy thing here, incorporates all 3 components of a kernel: the bran, the endosperm, and the germ. That's the definition of a whole grain. And so if a person consumes a whole grain, wrong button. This whole grain, you're getting the benefit of all of these vitamins and minerals, right? The thing is that most of us don't consume the whole grain. We consume variations on that theme, mainly refined versions or enriched versions. So anything that's refined is missing one or more of the 3 parts. Enriched grains are refined grains that they've added nutrients back. And so I really like this chart here. So in green shows what the 100% of nutrients of each of these micronutrients from a whole wheat product. And then in red shows the refined percentage, so what happens when you refine it. And then the yellow demonstrates what happens to that nutrient when you enrich it. And so in some cases, like riboflavin, thiamine, folate, it well exceeds what would be in that plant and that whole grain naturally. And we've done that for various reasons, right? For folate, we've done it because of the its relationship to neural tube defects, and so we enrich things. We add a whole lot more to kind of cover the population of people. And so whole grains versus, and then I just wanted to kind of make the I wanted to distinguish whole grain versus whole wheat, because I feel like we hear those 2 words and they may mean something independent of each other, and they're not. Whole wheat flour is always whole grain in the US. Not the case in Canada. So you have to look at the Canadian definitions. But you can find all of this information at the wholegrainscouncil.org. It's a really fabulous website. And so just another question to the audience. How many of you have gone and downloaded the dietary guidelines for 2015 to 2020? Yeah? Yeah, this booklet here. These are the guidelines, right? So how many of you have looked through these? Yeah, no one. This is just the dietary guidelines for Americans. I have it on my PowerPoint. But I'm just doing this because there's a lot of really, really good information out there on the recommendations for a healthy diet. And so I've kind of pulled from the ones of the 7 factors, or 6. We'll talk about sugar-sweetened beverages separately, but of the 6 that we're going to talk about, there's recommendations, there's guidelines. And so the guidelines, and we probably all know this, make half your grains whole grains. And then if you look at this table here, shows you how many servings. Oh, I'm not very good at this. Sorry, it probably gives you a headache. But the servings for based on age and gender. And the guidelines use these cup equivalents, which is mildly confusing, but not everything is proportioned the same, or weight changes, and so you can't do volume cups all the time, and so that's something that you just kind of have to look at. But examples of a serving of grains is a half a cup of cooked rice, 1 ounce of dry pasta, 1 slice of bread, 1 small muffin. And then this also comes from the Whole Grain Council. You can look for these stamps now. Has anybody seen these stamps on products, or I see some nods, yes. So that's a really good way when you're looking at labels to know what is a whole grain and what's not a whole grain, because marketing is just so incredibly effective. So some things to kind of keep in mind is choosing 100% whole grain foods, so trying to look for the stamp. Whole grain should be the first ingredient. The first ingredient should say 100% whole grain. Or the second after water, because oftentimes water will be in more abundance, right? So the ingredient list is listed in order of how much of that food is in the product. And so water could potentially have more water than flour. And so for foods with multiple grain products, like our beloved Dave's Killer Bread, you gotta really look and see where whole grain shows up on that label. Because in some of those bread products, it's very, very tricky, and it'll say enriched whole grain, right? That's not whole grain. Yeah.
When we're buying wheat bread,
Yeah.
would that be, what can we look for to, because I buy wheat bread all the time instead of the white
Yeah.
bread.
Yeah, so the question was, what do I look for when I'm buying wheat bread versus white bread? So you want to find on the label 100% whole wheat. That's what you want to see on the label. If it says enriched, then just know that you're not eating a whole grain. That's the information that you need to carry around in your brain, that if it's enriched, it's not whole grain. There's nutrients missing, and that's the piece. And so you just want to make sure that you're allocating half of your grain servings to whole grain. And what's the best way to do that? What can you eat to make sure you're getting whole grains?
So brown rice is a whole grain?
Brown rice. Yeah.
That's a whole grain?
Yeah. Brown rice. What are some other ways to ensure you're eating whole grains? Steel cut oats. Good. What else? Quinoa. All of our favorites. All the things all of you love to eat every day. Yeah.
Sorry I was late. I apologize. Thank you for being here.
Yeah.
Rye. Where is rye?
If it's like 100% whole rye, if it says enriched, then you know it's not whole. That's really the difference, is if it's enriched rye, then it's been refined in some capacity. And so when anything is refined, you're losing nutrients. And the whole, namely fiber, if anybody has listened to me talk in the past, I don't know if any of you have or have met with me independently, like fiber is the name of my game. And that's part of why you want to be eating whole grains. And namely, like if we go back, well, I'm going forward. Sorry. No, what am I doing? Fiber, yeah, so when you take away that bran and the germ specifically, that's where you're taking fiber away. When you're refining, you're mostly left with the endosperm. What is that? Does anybody know what that is? Starch. That's your starch. When you refine a grain, you concentrate the starch. When you remove the fiber, that starch, you don't slow down the rate and the amount of that sugar that you're absorbing. Does that make sense? Okay. All right, grains. Whole grains. Half your grains, whole grains. Okay, let's move on to processed meat. So this was a big one. This is a big one for people. So what is processed meat? Throw some stuff out there. Sausage, bologna, ham, deli meats, all yes, yes, yes. So this is the third leading factor associated with cancer burden among U.S. adults. There is a causal association to colorectal cancer. So there's the definition. So meats transformed by smoking, curing, salting, adding other chemical preservatives in order to enhance flavor or preserve them. So oftentimes you get these nitrates when you're doing these transformations that we think is a major link with cancer progression. We have not worked out the mechanism, and so it's still hard to really pinpoint, but those are some of the theories. And then the World Health Organization's International Agency for Research on Cancer in 2015 named processed meat as a carcinogen. They grouped it into the group 1 category. So yeah, it's in the same category as cigarettes and asbestos. But I just want to say something about that because it doesn't, it gets that classification based on the substantive evidence associated with that food, right? It's not the level of risk. For example, for processed meat, studies showing a 2-fold increase in risk of cancer. Cigarette smoking is a 20-fold increase, right? So the power is a little bit different, but the evidence is enough to put it in that group 1 category. There's enough evidence that we know it's a human carcinogen to get a group 1 classification. Does that make sense?
So a smoked salmon then, does that take the nutrients out of the salmon because they smoke?
It's the nitrates that are generated. It's the process of cooking. It's a cooking process.
So that
Yeah.
Carcinogen.
Yes. That's creating these carcinogens that then we're ingesting that go on to do damage to our cells. Yes.
So if you go to Safeway and you ask them to take that chunk of roast beef and they slice it thinly into sandwich meat for you, is that the same thing as the cold cut category?
Yeah.
Because the big chunk of primo beef or whatever has got the nitrates in it too?
It's the way they're processing the meats. Yeah. Cold cuts. Yes. Cold cuts. You asked about cold cuts. Sorry, I'm supposed to.
So
Yeah.
how package said no nitrate? It doesn't still not safe?
Yeah. I'm sorry.
Is it said they just take out the nitrate?
That hasn't quite been elucidated yet. She asked, if you take out the nitrates, is that better? And the evidence is still very mixed. We still don't really know because it's so new that we don't have enough data to say either way. Okay, I'm gonna, so I can get through this lecture, I'm really sorry. Let's do the questions at the end because I'm absolutely gonna run out of time. And I don't want to. I want to get through all this. And I'm happy to stay and we can chat. I don't have to talk again for another hour. So we can have conversations after the lecture. Okay, so recommendations. So there's 2 different recommendations here for processed meat. The American Heart Association has a less than 0.5 ounce per day, whereas the American Institute for Cancer Research says just don't. Don't do it. Unless it's a very special occasion. So try your best to just remove it completely from your diet. Okay, so let's talk about red meat now. So red meat is not processed meat necessarily, but there are some processed meats that are red meats, so they're not mutually inclusive. So what is the definition of red meat? I'm just clearing the air here. So it's meat from mammals because it has the myoglobin in it, which has heme, which heme is one of the theories that increased amounts of heme can increase the cancer process. And through the lipid peroxidation, quickly what that means is basically it damages the fats in the cell wall of our cells, and it creates these free radicals, which are like wild teenagers that go around and cause damage to cells. And eventually, if there's enough of that lipid peroxidation, the cell could die. Okay, and then there's other heterocyclic amines that are formed from high heat cooking, so that charring that you get from cooking that also has been associated with increased cancer burden. So what you can do is limiting, it's how you cook your meats. And so trying not to do it over an open flame, trying to cook at a lower, slower rate helps to reduce the amount of formation of the heterocyclic amines. Okay, so the AICR is the only organization that has a red meat intake, recommended intake, and that's really based on the causal association with colorectal cancer. And that recommendation is 12 to 18 ounces of cooked weight per week. And we all know what a deck of cards look like. That's approximately 3 ounces. So you get 4 to 6 of those a week. Okay. Dairy. Who thinks dairy increases your risk for cancer? Who's come across that? Yeah, dairy's kind of all over the place, really, when it comes to recommendations in cancer. So there's actually an inverse relationship. So an opposite relationship. So the more dairy you consume, the lower your risk of cancer is. With the possible exception of prostate cancer. The evidence is very, very mixed with prostate cancer, which is why there's less encouragement of consuming dairy out there for all cancers. But this study showed that it linked it to poor diet quality, people that don't consume enough dairy. And overall, the general population, which you may find hard to believe, doesn't consume the recommended intake of dairy. With the inverse relationship with dairy, there's this particular study that I'm kind of highlighting today showed that association, but there are many, many studies that have looked at dairy consumption and different types of cancer and have shown either a null relationship, which means there's just no association, like it doesn't increase or decrease. There's studies that show, and then the majority of them show an inverse relationship. Yeah. Yeah, no, that's absolutely fine. And then just having a short conversation about the hormones. They found that they don't they don't get absorbed in the human digestive tract, according to the FDA. You can take that for what you want. And then other investigators have looked at the RBST, and then the insulin growth factor, resisted pasteurization, and digestive enzymes. And so it just doesn't kind of get digested. And then the insulin growth factor, which is also has it looked at increases risk of cancer. RBST treated cows have slightly higher levels of the hormone IGF-1. But it has been shown that oral consumption by humans of this IGF-1 has little or no biological activity. But at this point in our culture, most milk doesn't have that hormone anymore. And then just in terms of antibiotics, milk collected from cows have to be antibiotic free. And that is true for both organic and non-organic milk. Okay, so here's the guidelines for dairy. The recommendations are that 3-cup equivalent per day, and then you're getting the majority of your nutrients. These are the majority of the nutrients that you're going to get from dairy. And this study that the CNN did highlighted the fact that they looked at dairy versus calcium. Because calcium is, when you're looking at survey data, it's really hard to pull out specific nutrients. And so dairy is kind of the way that people look at calcium, just to kind of give more context there. Most individuals would benefit from increasing consumption of low-fat or fat-free dairy products. And then some examples of dairy, and then just trying to limit sweetened milk and yogurt as much as possible, because that plays into added sugar that's in your diet. And this particular study, the results that in their discussion stated that dairy products are considered part of a cancer protective diet.
And does it matter if it's solid or liquid dairy, product
Yeah.
from dairy? That doesn't, okay.
Nope.
When they take fat out, it becomes processed, doesn't it?
I'm going to table that question till the very end. We're getting close, but I just want to make sure I'm mindful of the time. So the next thing that they looked at was, I put fruit and vegetable. They looked at them separately, but I kind of put them together. So here's the recommended dietary guidelines for Americans. So 2 to 3 cups of vegetables per day. And just for fun, right? So looking at lettuce and spinach and other raw vegetables, 2 cups are actually 1 cup that they're talking about per day. So it's a double. So just something to kind of keep in mind. And the CDC showed that only 9% of adults eat the recommended amount of vegetables in the dietary guidelines for Americans. I thought that was pretty profound, just kind of demonstrating how little of our diet comes from vegetables and fruits. And then fruit recommendations are 1.5 cups per day. And then this just shows, this is from all of these are from the dietary guidelines showing the cup equivalents. Okay, so how do you add more fruit and veggies into your diet? I'm sure we can all come up with 300 different ways, but here's just some ideas. Going for carrots and celery versus chips, with your hummus, or peanut butter with apples, peppers with salsa instead of chips. Adding more veggies into lunch and dinner, right? Trying to eat 2 servings of veggies, 2 different veggies at lunch and 2 different at dinner. And then trying to add in fruit and salads. How many like to eat fruit and salads? Yeah. How many never eat fruit and salads? 0 of you. All right, that's wonderful. Eating fruit for dessert. I mean, these are all very common things that we know, but sometimes we often don't make the choice, right? So this is just going back to highlighting is that you have the power to choose. You have the power to choose fruit or your cheesecake, or fruit on your cheesecake. And then color, really trying to get that rainbow of color. Trying to eat that rainbow of color every day. And then I really liked this quote from the American Institute for Cancer Research. They were talking about a study. They were reviewing a study, and this study just, I thought, really hit home. If everyone were to eat 10 fruits and vegetables a day, that could prevent an estimated 7.8 million premature deaths worldwide. That's not just cancer, but that's just kind of the overall mortality rates. It's pretty profound, and it's a fairly simple thing to do, or a simple transition that you could make in your life. And so here was their example of getting 10 servings a day: 1 orange at breakfast, a carrot and apple at lunch, a large banana at a snack, broccoli and a large salad with tomatoes at dinner. So it puts it into a nice context of like, well, that's just not that hard. The key, though, is consistency. Right? So something that I talk about a lot when I'm counseling people is you really need to be consistent 4 to 6 days of the week, 52 weeks of the year. That's the key, is getting this, making this shift that this just becomes your pattern of eating most days of the week. Right? And then you have your bacon on Sundays once a month. Or something, right? Or once every 2 months. Okay, so those are the 7 key dietary factors that this study looked at, and I just wanted to kind of go a little bit deeper into what these recommendations are and how you can potentially achieve them with little effort or minimal effort. So now we're going to kind of switch gears, and I'm going to go through some of the things that I come across regularly and that I hear people that want to kind of talk about. So vitamin D is always a hot topic because, again, the evidence is really mixed out there. And so even though the evidence is really mixed, like we understand the importance of vitamin D for many, many hundreds and hundreds of biological processes. And most importantly, in the cancer progression world, it helps to keep inflammatory markers low, and it helps to regulate the cell cycle. And so what we do know and what we do understand is that you need adequate levels of vitamin D. And so I put the recommendations here just for perspective. So in terms of, for people that have a high risk of cancer, the recommended lab range that you want to have is between 30 and 50. Some practitioners, especially at SCCA, will bump that up into the 40 to 60 range, but 30 to 50 seems to be pretty clinically relevant. And then how do you assess for adequate vitamin D status? Well, if you're not regularly consuming fish or supplementing, you should probably be supplementing with some amount of vitamin D just because we live under a blanket most of the year. And we've seen clinically that 2,000 international units a day is a good maintenance dose. And what that means is it's, as a maintenance dose, it kind of keeps you wherever you are. It won't increase or decrease your lab values. If you're taking more than 5,000 international units a day, I would recommend a baseline vitamin D to assess for vitamin D toxicity, because that is a dosage, if you're taking it consistently over time, that could potentially increase your level outside, above the 50 to 60 lab range. So that's what I wanted to say about vitamin D and give you some kind of specific recommendations to move forward with. Okay, omega-3 fatty acids, why are they important? Why am I talking about them? Inflammation. How do you get omega-3s? Fish, flax seeds, yay. Flax seeds are lovely. Do they need to be ground? Yes. Why? Yeah, you poop them out, unchanged. You see little seeds in your poop. That's why, because we don't have access. Our enzymes don't have access to break down and absorb them. Do we make omega-3 fatty acids? Does our body make them? No. No, we don't make them. We do not have the capacity to make them. So if you don't consume them in your diet, you don't get them. And they have a very important role in lowering inflammatory markers. So fish oil versus fish. Lots of people want to take fish oil to get their omega-3 fatty acids. My argument as a dietitian is I would love to see everyone get their omega-3 fatty acids from food. And looking at some of the studies that have been done on over-the-counter brands, they found more than 30 other saturated fatty acids in some of these brands, which some of them were deemed sufficient enough to inflict harm themselves. And then due to the lack of regulation on supplements, it's advised to either obtain a fish oil from a prescription or source from a third-party tested company. And eating cold water fresh fish 3 times a week, wild fish that is best if possible, or getting your omega-3 fatty acids from the plant-based sources. Oh my gosh, this just doesn't work for me. Yeah, so salmon, tuna, mackerel, sardines are the animal-based sources. And then ground flax seeds, walnuts, pumpkin seeds, leafy greens, and grass-fed meats and dairy have higher amounts than conventionally raised meats and dairy, but it still pales in comparison to grass-fed meats and dairy, yeah. And if you're relying on fish oil versus eating fish or the plant-based sources, then you're not getting all of these other added nutrient benefits that have protection against cancer. Okay, the last couple of things, intermittent fasting. How many have heard about intermittent fasting? Most all of you. Yep, it's pretty hot right now. There's some really interesting data that's coming out around intermittent fasting, around managing obesity, type 2 diabetes, and cardiovascular disease. There's preliminary research on during treatment, especially in breast cancer patients, how it kind of acts as a protective mechanism during chemotherapy treatment. That data is very, very preliminary and needs a lot more studies to kind of support that. And so what is intermittent fasting? So There's lots of variations on this theme. What I'm talking about is limiting food intake to daytime only. And so that idea that you're taking a break, you're breaking from your days of eating, and ideally you're doing it over your sleeping hours, right? Breakfast, you're breaking your fast from the evening before. Typically, it's ideal to start with like a 12-hour fast and then increase from there. So 8 p.m. to 8 a.m., you consume no food is the idea. And then some people do 14 hours, some people do 16 hours. And you have to be very careful the further you go out that you don't become hypoglycemic, meaning that your blood sugar goes too low. So while it's been shown to be beneficial in reducing hemoglobin A1C levels, you have to, in diabetics, you have to be careful that you don't go hypoglycemic, meaning that your blood sugar gets too low, and then that can be really dangerous. So just being really cautious if you are a diabetic and you want to move into the intermittent fasting realm. And then here's some of the preliminary studies that have shown that it can decrease lower inflammatory markers through different metabolic signaling, reduce leptin, that IGF that we talked about, and glucose levels, that desmoplasia, which is the fibrous tissue that can surround tumors, and then in those breast cancer studies, the really preliminary studies, facilitating that better therapeutic drug delivery. All right, so the last two things that I want to talk about are the ketogenic diet and then does sugar feed cancer. So what is a ketogenic diet? Specifically, it's a very low carbohydrate diet, and the hypothesis, at least in the cancer world, is that tumors rely on glucose to meet their energy demands, and thus you can starve the tumor and reduce its growth. Based on this hypothesis, we think that, or there's a lot of information out there that states sugar feeds cancer. And that is just not the whole picture, as oftentimes with nutrition information, there's little nuggets of truth kind of tucked into a lot of things that aren't true. And it's really, this idea that sugar feeds cancer is really about the relationship between obesity and insulin resistance versus sugar as fuel for cancer cells. So let's look at the ketogenic diet breakdown. So the classic ketogenic diet is up here on the left, or your left. So it's 90% fat, 4% carbohydrate, 6% protein. That works out to be about 13 grams of carbohydrates a day, which is about what? Does anybody know what 13 grams of carbohydrates looks like? One slice of bread. That's it. So with that, you have to be very, very regimented. Most of what's happening out there in the public right now is these modified ideas of the ketogenic diet, where you're not actually in what we call ketosis. It's a very, very hard diet to follow and sustain. All forms of the ketogenic diet, so all of these forms here represented, are considered nutritionally inadequate. Most of them require a carbohydrate-free multivitamin because that counts towards your total carb intake, with trace minerals and a supplement of calcium and vitamin D. Patient adherence to this diet is so incredibly poor that they're having hard time doing studies on these diet plans and the efficacy around it because patient adherence is it's so bad. Even in populations of people where this diet has shown a curative effect in the epileptic populations, even those patients tend to not be able to sustain this diet. So what they'll do a lot of times with them in the pediatric scenario is they'll put them on a tube feed for the duration until they can come off of it. So the bottom line is that the lack of consistency and efficacy in the current literature, along with this long list of adverse effects, make it not recommended as a therapeutic approach in the cancer setting. But people are doing it a lot kind of in the mainstream media for weight loss, and that's just kind of a whole separate conversation. So I wanted to kind of keep this in the context of cancer today. And then to kind of wrap it up with 1 minute, does sugar feed cancer? So the short story is Yes, sugar is a fuel for tumor cells. It's also a fuel for every single cell in your healthy cell in your body. It's our main nutrient of choice to get our energy needs met. That being said, if we don't get enough glucose from the foods we eat, our bodies will break down amino acids to make sugar, to sustain a fairly constant range in our blood. If we go below that range in our blood, then we start to go hypoglycemic. If that keeps dropping, we wind up in a coma in the hospital. And so that's why this ketogenic diet is so, you need to be monitored by a dietitian because of the overall inadequacy from nutrition that you're getting. And the risk of going hypoglycemic and having some real consequences. So a little bit about the sugar and insulin connection. So we know that insulin is produced in response to the digestion and absorption of carbohydrates that produce glucose. So excess sugar can lead to obesity, can lead to insulin resistance. That insulin resistance then leads to metabolic syndrome, which leads into type 2 diabetes. Insulin resistance can increase the insulin growth factor binding protein, which is responsible for binding insulin growth factor, and those are states of chronic low-grade inflammation. Those are known drivers for cancer progression. So it's not sugar itself that's the problem. It's the choices that we make that we wind up with an overabundance of sugar in our bodies on a very regular and continual basis. You having a soda once a week is not going to give you diabetes, for the most part, right? If all other things are normal and you're healthy and active and there's like 30 different other components that you have to consider, it's the soda times 3 every day for 5, 10, 20 years, coupled with a low quality, low poor diet. That's really the heart and soul of like this idea around sugar feeding cancer. It's like they've taken that sentence and removed it from a paragraph and left all the context. Okay. Does that make sense? At the end of the day, I think this quote is really lovely. More studies will not suddenly prove that something is untrue is now true. It is not a lack of will by the scientific establishment, but an adherence to common sense. Deciding on fiction over fact is irrational and irresponsible. It is like deciding that the moon is made of cheese because you think it is, despite no evidence to suggest or confirm that it is, and a lot to suggest it is not. And this is a quote from one of the PhD geneticists that I thought was just really, it was just nice way to kind of end it. Thank you for your time.
Thank you.
Okay, I think there's a few minutes. I'm done. Is there a few minutes for questions? Okay. Yes. The Mediterranean diet is lovely. Yes, it is a well-studied, there's a lot of good evidence behind it in reducing your risk of chronic disease overall. Yeah, it's lovely. Yes.
Comments on coffee and peanut butter.
Oh man, I took my coffee slide out. Coffee is amazing. There's no increased risk for cancer in coffee. That's like peanut. I don't know any evidence increasing your risk of your intake of peanut butter increasing your risk of cancer. I don't know of any data.
So with coffee, what I know, because I come from a country where they grow the coffee, it has a lot of antioxidants where you have to drink it black. Because it's all the additives with sugar and stuff that it's not good, and then you change the composition of it. So black coffee.
Black coffee. Yes.
Uncured bacon, that's all I'm fine now. What's the difference between uncured and cured?
The process in which they get it to bacon. So if it's uncured, then you're good. As long as it's like it's not made into bacon by like using nitrites and nitrates. Yeah. Yes, in the back. Yeah, there's two forms of vitamin D, D2 and D3. You want D3. Yes, good question. Yes. Oh.
So like smoked salmon.
Yeah.
And so are we talking about specifically added nitrates, or is the nitrate come into the product through the smoker?
Yeah, so she's asking the smoking generating the nitrates versus adding nitrates to create the final product. From my understanding, smoking is still going to create those carcinogens versus adding nitrates to versus the chemical process of getting to that same end. Does that help? Yes, we'll do. Sugar substitutes. Avoid them if possible. All of, the thing is like, there's, the data is really mixed around sugar additives, and there's some theoretical models that have indicated that you're still getting that sweet response in your brain, which is dumping your, like it's signaling that release of glucose. Which, yeah, because it's sweet, right? Your brain's like, oh, there's something sweet. I'm sorry, insulin. It's going to dump insulin so that you can pull in glucose, but it turns out there's no glucose. And so now you have this raise in insulin, which is going to drop your sugar levels even low, which leads to craving more of these things.
Is there any evidence around freshness, talking about whole grains? I know a lot of bakers now are trying to get like a 2-week window from when the flour was harvested and ground to,
Yeah. Yeah, so the question was, the freshness around like flours, and as soon as you're pulling a nutrient out of the ground, you're losing nutrients. So it's hard to really know how much and the rate at which things are losing, but yeah, if you can get, the fresher you can get it, the better. Mm-hmm. Yeah, yes.
What were the suggestions for substitutions for processed meats in general?
Yeah, so, trying to do white meats, turkey, fish, tofu, mushrooms, more vegetables.
To piggyback on that, do you happen to know the whole chickens that are cooked like Costco sells?
Like the rotisserie?
Yeah, aren't
Yep.
there injected things in there?
Oh, I can't answer. I have no idea. I don't know.
It's like a delicacy.
I don't know the answer to that. I'm sorry. That's a good question, though. She asked if they inject things into whole chickens when they roast them, and I don't know. Yeah. Okay, thank you.
Come speak to my high school students.
Sure.
I mean, they're young enough to.
I would love it. That's where you need to get them. Absolutely. Yeah, thanks.
What's your thoughts on pea proteins? There's a pea protein powder. There's a whole bunch of burgers that are using like Beyond Meat's coming out with, and I tried that.
Okay.
Any take on alternative meats coming out with pea protein using that?
Yeah, so her question was about pea proteins and like all the meat alternatives to get people to away from eating red meat, but still getting the sensation and the satiety from eating something that's meat-like. My honest answer is to figure out how to get more beans in your diet. Because you're still processing. It's still a processed product. And so the closer you can stay to a whole grain or a whole food product, that's going to give you the optimal nutrition. Anytime you're pulling stuff out, you're losing nutrition. But if you like them and it helps, then you can do that. It's a good transition food, maybe. Last question, yes.
I was curious about, you said that there's no antibiotics in organic and non-organic milk. I haven't been able to drink milk for years, but I just started drinking organic milk, and I'm doing fine with that. So I just assumed it must be because of antibiotics. And so I haven't looked into it. I'm just wondering what your take on that. Why my digestion is now responding to organic when for years I've had digestive problems.
So she's asking about, and I'm going to probably table that to outside, but asking about why organic is not giving her GI issues, whereas in the past drinking dairy has given her GI issues. That's such a hard question to answer without like asking you a lot more questions. So we can chat outside, would be my suggestion. All right, you guys, thank you so much for your time. I'm really grateful. Have a nice rest of your day today.